tissue fluid and edema formation. The title of this lecture is a tissue fluid and edema formation. And I will concentrate on these points. Number one, the mechanism of hydrostatic capillary pressures and colloid pressure. The other thing is the causes of tissue fluid and edema formation. Now, if you have a look to this slide, you can see here, we have here the capillaries, and then this is the cell. In between the capillary and the cell, we have the interstitial tissue fluid space. Now, before going in the details of this lectures, there must be some short introduction to let you know what is the target of this lecture. Now, this capillary membrane, as you know, is permeable to certain small organic molecules like the amino acid, fatty acid, glucose, urea, white blood cell, bacteria, ions, minerals, and so on. Therefore, we have hydrophilic and lipophilic substance. The lipophilic substance can pass through the bilayer membrane like the CO2 and oxygen, whereas the hydrophilic substance, which are the like amino acid, fatty acid, glucose, and the others, they pass through a certain microscopical channels known as the pores of the capillaries. And these are, we call it polar substance. Now, if you have a look to this capillaries, we can find we have an arteriolar end and venular end, or arterial end and venous end. In the arterial end, we have this hydrostatic capillary pressure, and we have the osmotic pressure, or here in this lecture they call it colloid pressure. By the way, this colloid pressure have another name, the osmotic pressure, oncotic pressure, or colloid pressure. All of them is the same meaning. Now, the origin of this colloidal or osmotic pressure is from the high concentration of a plasma protein. Now, the high concentration of plasma protein is the origin of this osmotic or colloid pressure. On the other hand, we have another capillary pressure, which is the hydrostatic capillary pressure. Now, this hydrostatic capillary pressure is different, as you can see, from the arteriolar end than the venous end. Now, normally, the hydrostatic pressure here is 32 in this end, and you can see this arrow which pointed downward. That is, this hydrostatic capillary pressure force water out, as you can see here. This arrow directed outside, so that this force water out. On the other hand, we have another pressure, which we call it osmotic or colloid pressure. As you can see in this arrow, is suck water in. This arrow opposite this arrow. You see, this force, the osmotic pressure, is against the hydrostatic pressure. Another small pressure is the interstitial tissue pressure or fluid pressure, which is only 1 millimeter mercury. This is beside the osmotic pressure in the same direction, as you can see. This is 1, this is 25. By the way, this osmotic pressure is constant. 25 millimeter mercury is our osmotic pressure in our body, whereas the 32 hydrostatic pressure can be changed according to the blood pressure of that subject. Therefore, if we can see here this equation that 32 minus 25, 32 minus 1 minus 25 will be 6. So this net result pointed that the fluid has to go out of this capillary, and we call it filtration, hair filtration or fluid formation in this region. The fluid will come out as you can see according to this equation. By the way, I should mention that there are a lot of mathematical equations can describe many physiological phenomena. This is one of them. This equation can explain how the fluid filtration in this capillary end. Therefore, what happened here, that the fluid is formed here. Now, we have about 8 liters of a fluid daily, per day, 8 liters daily of a fluid pass in this interstitial tissue fluid from this end to this end. Now, only 4 liters of this fluid participate in the mechanism of fluid formation and reabsorption. In the other end, this is reabsorption. Now, again, we have a fluid formation here. Of course, the way why there is a fluid formation here and the fluid reabsorption here, this is for the reason for the nourishment of the fluid and the tissue, nourishment of the tissue and the cell. Yeah. The idea or the benefit of this fluid formation and reabsorption is that to reach the nutrient material to this cell, so that the daily the metabolic rate daily can be take place. The need for the metabolism of this cell need nutrition, need oxygen, need nutrient material, amino acid, and so on. So that what happened here, a fluid formed here to give the nourishment of this cell, and then there must be a waste product. This is an important phenomenon. Usually, cell working, do metabolism, give work to human, to exist their daily life, there must be waste product. The waste product has to be reabsorbed from this end, the venous end, by reabsorption technique. So again, so that the net result here from this equation is 6 millimeter, which force water out. Now, after the function have been performed, that is to say, to give the nourishment of this cell, as I said, there is waste product in this region. Now this figure is different here. Now the hydrostatic pressure in the venous end is only 12 millimeter mercury, which force water out. And the 25 osmotic or colloid pressure, as I said, it is constant, the same 25 here, the same 25 here, which suck water into the capillaries. Besides that, this one, again, constant interstitial tissue pressure, which force water, which suck water into the capillary. So we have these two forces which suck water into the capillary against this forces which force water out of this capillary. Now, if we go to this equation, now 25 minus 12 minus 1 equal 14. You can see the number 14 millimeter mercury is the for the reabsorption of this fluid, which is the waste product, which is the net result of the metabolism in this tissue and in this cell, and then it will reabsorb in this end. You can see the venous end. So just briefly, fluid formed in this area by this by 6 millimeter mercury, the net result, and we have 14 for the reabsorption of this fluid in this capillary. So this is the mechanism, in fact, for the way how the nourishment or to get the nutrient material reach to the cell for the daily life and the metabolism activity to do any work in daily life. The next part in this lecture, one point before that, I should mention it, in fact. As I said, this is the capillary. Here we have interstitial tissue space, and this is the cell. Never ever the membrane of this capillary come in attachment to the cell membrane. There must be this space. There must be this interstitial tissue space. Without this space, without this interstitial tissue fluid, this operation cannot exist, and if it happens, there will be a disease condition, not normal physiological aspect. If we go to the second slide, now this slide shows that the total volume of water in our body is 45 liters. Now this divided into two main parts. We have intracellular fluid and extracellular fluid. The intracellular fluid is 30 liters. You see that the biggest part of this is in the cell, and the extra cell outside the cell is only 15 liters. Now this 15 liters subdivided into interstitial tissue fluid, which we just mentioned in the last diagram, and it is 11 liters. And the other part is the plasma fluid, is 2.8 liters, the plasma fluid in the capillary, in the last figure. The rest of this fluid is in this different part in our body. We call it the transcellular fluid. Transcellular fluid, 1.2 liters. This transcellular fluid have the brain ventricles. You know, in our brain we have ventricles, have a fluid, and like the cerebrospinal fluid in the spinal cord, and we have in the peritoneal fluid, the peritoneum, you know, they cover the in the abdominal cavity, we have a fluid, peritoneal fluid. Pericardial fluid, the pericardium, which covers the heart. And we have the pleural fluid, cover the lung, and the joint capsule, ocular fluid in the eye. Sorry. Now, the next slide here, sorry. We go back here. The causes of tissue fluid edema formation. Now, this is the last thing in this lecture. Causes of tissue fluid and edema formation. First, the first cause of tissue fluid edema formation is a deficiency of plasma protein. If you remember, when I mentioned in the beginning of this lecture, I said that the osmotic pressure or colloid pressure or oncotic pressure depend on the high concentration of a plasma protein. If you like, I can go back to the diagram. This one, I said that the osmotic or colloid pressure depends on the high concentration of a plasma protein. Therefore, if we have deficiency in this plasma protein, certainly the osmotic pressure will decrease. And the decrease in a plasma protein might be due to malnutrition. That is to say, the diet of a subject have deficiency with a protein. Therefore, we have a plasma protein deficiency, and this will cause a decrease in osmotic pressure, you see. Now, one problem, in fact, for the plasma protein deficiency is not only that one subject eat food which have less amount of a protein, but sometimes there's a problem in the liver itself. The liver cannot do the process of synthesis of a protein. Therefore, the subject take protein, sufficient amount of protein, but the liver have some problem. Disease in the liver cannot do its function for the synthesis of the protein. Moreover, sometimes the liver is intact, is healthy, but we have a problem in the kidney. There is nephrotic syndrome. The kidney pass the protein in the urine. You know, the protein in the urine should not present. Normal urine should have no albumin in the urine. The other cause is an increase in venous pressure. As you can see here, this venous pressure is 12 here. Venous pressure in this end. If this become, for example, 20, and if we go to this equation, if this is 20, so this will not be 14. This will be maybe only near to this, maybe 8. So 8 is not enough for the reabsorption of a fluid. Therefore, the fluid will accumulate here in this part of interstitial tissue space. So the venous pressure, again, is an important thing. Another thing, if there is damage to the capillary, you can see here if this is damage or injury by car accident or insect bite, simply. The damage to this capillary membrane will cause extravasation of the fluid. The fluid will transudate out, come from the capillary to this space and forming edema formation. Right. The other cause, in fact, may be postural hypotension, also can cause some fluid formation. So these are, in fact, the most important causes of tissue fluid formation, and sometimes the fluid will accumulate in other regions in our body. For example, a fluid in the peritoneum, we call it peritoneal fluid, or a fluid in the pleura, we call it peritoneal effusion, and a fluid in the pericardium, we call it pericardial effusion. You know, the pericardium يعني شغاف القلب. The pericardium, we have two layers, outer, inner layer. In between, there is very slimy, very small amount of fluid, which minimize the friction between the outer and inner pericardium during the contraction of the cardiac muscle. Now, sometimes in a disease condition, there is a lot of fluid in this space between the outer and inner pericardium. Therefore, you can imagine that a huge amount of fluid surrounding the heart, this certainly will impair the contraction and the relaxation of cardiac muscle. The other cause, in fact, the last cause of this edema formation here is the damage to the lymphatic or blockage to the lymphatic vessel. You know, I said in this at the beginning that we have 8 liters of fluid pass here. Only 4 liters participate in this operation. The other 4 liters go to the lymphatic vessel. If you imagine that here is a lymphatic vessel, so any fluid will go back and reabsorb through the lymphatic vessel, and then there is joining between the lymphatic vessel and the blood vessel in the neck region. Now, here, therefore, if there is a blockage of the lymphatic vessel, certainly we will have accumulation of fluid in this region. So the most important causes of lymphatic blockage is a certain parasite known as filaria and a condition known as filariasis. These are the most important thing in this lecture. Briefly, we talk about the capillary membrane, and we said we have hydrophilic, lipophilic substance, and the lipophilic pass through the bilayer region of this membrane, whereas the hydrophilic pass through the pores of the capillaries. And then we talk about these pressures, and we said we have hydrostatic and osmotic pressure. In this region we have filtration, and in the other region we have the venous capillary pressure. We have 12 and 25, which is constant osmotic pressure, and in this region reabsorption will take place. This lecture, in fact, is very important lecture. You may get benefit of this lecture when you become a doctor and then certificate doctor. Thank you very much.